Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Calots triangle and the hepatobiliary triangle. So let's look at the boundaries and later on we'll see the diagram as well. So first we are looking at the Calots triangle. So Calots triangle is bounded by superiorly. So superiorly what we have, there is a superior border. So SP, superior border of the cystic artery. Next is medially what is present. Medially, both hepatic and calots have same thing, that is a common hepatic duct. So inferiorly what is present? It is the cystic duct. Now let's see the diagram. So when you look at the diagram, there is the presence of liver and there is the gallbladder. So this is nothing but the cystic duct. This is the cystic duct, and there is presence of the common hepatic duct. This is the common hepatic duct, we are writing it as CHD. Then comes the presence of the cystic artery. So this is the cystic artery. Now let's look at each triangle. So the triangle in the bottom, this is nothing but the Calots triangle. This is nothing but the Calots triangle. Next is the other triangle. So the other triangle is the bigger triangle. So this is nothing but the hepatobiliary triangle. This is the hepatobiliary triangle. So now let's look at the boundaries of the hepatobiliary triangle. So in terms of the hepatobiliary triangle, the superiorly what is present, it is the inferior surface of the liver. It is the inferior surface of the liver. So medially what is present, medially what we saw was the common hepatic duct, and then inferiorly it is nothing but the cystic duct. So other important things to notice, what are the contents of the Calots triangle? So when we look at the Calots triangle, we are looking at the contents. The contents of the Calots triangle, it includes, there is a lymph node. There is presence of the lymph node of Lund. So this is the sentinel lymph node for the gallbladder. This is the sentinel lymph node of the gallbladder. Next is what is involved is the branching of the cystic artery. Next is the branching of the cystic artery. So another branching of cystic artery, this is from the right hepatic artery. This is from the right hepatic artery. To learn and grow daily like this, please do subscribe.